This presentation is on eating disorders. The three types of eating disorders that I'm going to be talking about are anorexia nervosa, bulimia nervosa, and EDONS. Anorexia is an eating disorder characterized by distorted body image, an obsessive desire to be thin, fear of weight gain, restrictive eating, and consequently extremely low body weight. Bulimia is an eating disorder characterized by distorted body image, binge eating, and compensatory purging acts such as induced vomiting or the use of laxatives. The DSM recognizes other eating disorders and refers to them as EDONS, or eating disorder not otherwise specified. Specifically, I'm going to be talking about a third eating disorder that is getting a lot more attention with the increased rates of obesity. It's called binge eating disorder, or BED. BED is an eating disorder characterized by frequent binge eating that is accompanied by feelings of distress and loss of control. Unlike bulimia, these binges are not followed by compensatory purging behaviors. According to a recent study by Charlotte Markey, the development of eating disorders is increased by the emphasis of three different values in a specific cultural society: eating behaviors, body image ideals, and perceptions of health. For example, eating behaviors that are taught or emphasized in a culture or family, whether they emphasize food restriction or overindulgence, the result is often that the child learns to rely on external cues for eating, time of day, parents, boredom, or social situations, rather than internal cues such as hunger, thirst, and feeling comfortably full. A culture's view of ideal body image and what is considered attractive plays a significant role in the development of eating disorders. For example, in the United States, the preference for thinness is emphasized heavily in the media, and young girls are taught to look up to and admire thin women. The astounding impact of the media is demonstrated in a famous study that observed the cultural eating habits in Fiji. For generations, Fiji had been known for its sizable food portions and preference for more robust women. But the introduction of the television provided Fijian women with a new ideal body image, and the number of eating disorders, which were previously almost non-existent, increased dramatically. In ethnic groups such as African Americans and Latinos, who prefer higher ideal body weights, the number of eating disorders is significantly lower than their European American counterparts. Finally, a culture's view of what is healthy may also have an impact on the development of eating disorders. Many cultures today greatly emphasize the health risks of obesity, but tend to ignore the physical and psychological dangers of excessive thinness and eating disorders, sending the message that it is better to be too thin rather than too fat. People with eating disorders suffer both the psychological and physical effects of the disorders. Eating disorders are often associated with emotional problems such as depression, anxiety, and OCD. Other health risks include irregular heartbeat, orthostatic hypertension, also known as dizziness, decrease in bone strength, and of course, significant dental problems. Patients with BED are at a high risk for obesity and health risks associated with being overweight. Adolescents with eating disorders, specifically those who purge frequently, are at risk for engaging in other unhealthy behaviors such as unprotected sex, suicide attempts, substance abuse, and sexual promiscuity. There are three popular types of treatment for eating disorders: cognitive behavioral therapy, drug treatment, and behavioral weight loss for patients with BED. Cognitive behavioral therapy seems to be a popular form of treatment for people suffering from BED. Psychologists also noted the importance of finding ways to help those with BED lose weight to prevent them from developing other associated health risks. This treatment is referred to as behavioral weight loss, or BWL. Another study found that when cognitive behavioral treatment for bulimia and BED were coupled with the use of antidepressants, patients showed significant improvement, although patients with anorexia did not respond to psychotropic medication. Psychologists also reported other methods of therapy such as trauma therapy, emotion regulation, and family therapy that seem to be effective in treating all three types of disorders. In treatment for all three eating disorders, researchers found that the average amount of time that it took for patients to recover was 6 to 8 months.